posterior abdominal wall with the peritoneum removed. So this would be the left side. You can see the aorta is slightly on the, not slightly, but on the left side of the body of the aorta, and the inferior vena cava is just slightly to the right of midline. Midline would be like right just under the inferior vena cava here. Typically, these are pretty even, but typically the right kidney is slightly lower than the left, and that's because of the displacement that occurs by the liver. The same thing with the ascending colon, where the ascending transitions to the transverse colon is slightly lower than on the splenic side. And renal veins lie anterior to the renal arteries, so it's a little bit more difficult to see the arteries in location. And then this structure right here is the ureter, okay, which is carrying the formed urine down to the urinary bladder. So if we look at, before we look at functions of the kidneys, let's just go through briefly a little bit of the development. And these terms you've already heard before. So we talked about that with the reproductive system. Okay? So it's not brand new information. And again, these images are on D2L. But remember, this is about the only organ I can think of where we actually have three separate developmental structures. In the heart, in the brain, we have early structures that mature and certainly change, but not appear, disappear, and then another one shows up. And that's what happens with the kidney. So the first component that appears is the pronephros. It has structures, if we look at the tubular structures in this image, the pronephros appears to have the nephron structure, the little couplate component there. But if you notice, the blood supply, what we see here, is not intimately associated with that complex structure, and there's actually no filtration that takes place. There's no filtration. Remember the definition of filtration from 430? When we talked about membrane transport and diffusion and osmosis and so on.
Something down at concentration.
Filtration is separation by size.
Okay.
So if we have filter paper and we pour solution into the filter paper, what is the force that pulls that fluid through the paper?
Gravity.
Gravity. What is the force that results in filtration in the kidney? Blood pressure. So if you have an astronaut in space where there's no gravity, they're still going to be forming urine, okay? And you can still form urine hanging upside down from the monkey bars. So the gravitational force pushing small particles across the filtration membrane is occurring between this relationship between the blood vessel and the epithelium of the nephron. And that is what's not taking place in that early kidney. So no filtration occurs. So why then bother having it? I don't know why we have three different kidneys, but since pronephros is there, what it appears to do is to induce, meaning to change, modify the expression of various genes for the development of subsequent kidneys and the reproductive system. Now the rest of our organs develop without some kind of inducement of a structure that disappears. Okay? The optic nerve induces the lens to develop, and the lens induces the development of the nerves in the optic nerve. So we have that same kind of interactive relationship, but that appears to be the major function of the pronephros, is to induce both reproductive tubule and subsequent kidney development. Then as the pronephros is disappearing, and it disappears from the cephalic region towards the caudal region, so the upper portion, as you can see in the middle part here, is degenerating, and we see the appearance then of the second kidney, which is the mesonephros. And this does function to filter blood. So filtration occurs. And it is also the mesonephric duct that becomes the male reproductive, so our efferent ductules and epididymis and vas deferens develops from the mesonephric duct. So the mesonephric duct gives rise to male reproductive structures.
You want us to know so specifically if you mentioned or?
You know them already. So it gives rise to male reproductive structures, starting with the efferent ductules through the vas deferens. Okay, and technically the upper part of the urethra, but we didn't even get that technical in the male reproductive component. And then finally, the third kidney.
So is it degenerating further down into the?
Yeah, so the pronephros degenerates, and then the mesonephros starts to degenerate. This part right here, leaving behind just the duct, which becomes associated with the testes, and then growing out of this lower portion here, we see the true kidney and ureter. And that's what's going to develop into this. So the metanephros. So I'll write it over here where you guys can actually read it. So this is the final kidney, and obviously filtration is going to occur here. Now, interestingly, where does the kidney end up? Retroperitoneal. Does it end up low down here near the bladder? It actually ends up back where the pronephros originated, so that ureter grows, and the true kidneys, the metanephros kidneys, actually end up high in the posterior abdominal wall. So let's look at its location. So this is a cross-section of the kidney, and then we'll come back to that in just a moment. But in its full location here, the upper portion of the kidney is actually on the lower portion of the diaphragm. Okay. Yeah. The top part of the kidney is going to be, actually is on the diaphragm, because if I were to draw, I'll do it over here, you guys can actually see. So here would be the two lower ribs, the 11th and 12th ribs, the vertebral ribs, and the kidney actually is on those two lower ribs, and so that the diaphragm would be that portion covering the ribs behind it. So that's the only bonus support that the kidneys have. All right, so on page 3 of your lecture notes is a list of some of the functions of the kidney. And here it is just to say, so what does the kidney do? Probably the first answer, unless you just had the blood lecture, would be the formation of urine. All right, the excretion of waste. What particular type of waste excretion is unique to the kidney? Urea, uric acid, ammonia, which are all forms of nitrogen waste. Okay. In addition, we know with erythropoietin, the kidneys are a site of hormone production that increases red blood cell generation, erythropoiesis. And actually, regulation of blood glucose is not a true statement. It certainly reabsorbs glucose, but it's not, doesn't regulate its reabsorption. So the other 3 components here have to do with the process of filtration. We talk about that process on Tuesday next week. But essentially, all of the kidney will filter anything that's small enough to pass across the filtration membrane, which is very similar to our respiratory membrane, in that it's a sandwich of 2 simple squamous epithelia and basement membranes in between. And so sodium ions, potassium ions, amino acids, glucose are all molecules that are small enough to pass across that membrane in between the pores, through the pores. However, we don't have those components in our urine. So we don't have amino acids in as a normal urine content unless there's some disease process. We don't have glucose unless you're diabetic and you have too much glucose to be reabsorbed. We reabsorb almost all of the sodium ions. All right, so all of this gets reabsorbed back. So in doing so, the kidney becomes an important site for regulating electrolytes, sodium, potassium, calcium being some of the most important, and hydrogen ions. So we just got through talking about how the respiratory system is affected by pH. And if you blow off CO2 and you don't have as many hydrogen ions in your body, your breathing becomes slower or even suspended until those hydrogen ions build back up again. And so that is a mechanism by which the body can help to regulate pH, is to suppress or increase respiratory rate to affect the pH. Another mechanism is the kidneys. So the kidneys can increase or decrease the amount of hydrogen ions that the urine contains. And then, of course, the reason that we're interested in blood volume and blood pressure is because that's the source of the force in filtration. So if your blood pressure is low, you're not going to have much urine output because you don't have sufficient force to push those small molecules across the filtration membrane. If blood pressure is too high, you can destroy that filtration membrane and allow large molecules, whole cells, or protein molecules to cross rather than limiting it to amino acids.
So is that another downfall to high blood pressure?
Mm-hmm.
Can affect the
It's
kidney?
damage to the kidney filtration mechanisms. Okay.
Didn't know that.
So we'll be looking at these as we go through the structure of the kidneys. So back to this image, that is a cross-section of the kidney location. The peritoneum, which we discussed briefly when we were talking about the reproductive system and its ligaments that were formed from the peritoneum that supported the uterus. So if I draw a diagram, I'll reverse this from the pattern that you see on the board. And here would be our body wall, vertebra, and muscle. So the membrane that is attached to the body wall is identified as the parietal peritoneum. However, the kidneys are located between the posterior abdominal wall and the parietal peritoneum. And so they are considered to be retroperitoneal. And you can see the kidneys here. There's adipose tissue around them that helps to hold them in place. There's a thickening of some of the peritoneal structures from the spleen to the kidney or from the liver to the kidney. But other than that, there's not a lot of support for the kidneys other than that perirenal fascia. Posteriorly, we have muscles. So we looked at skeletal muscles associated with breathing. And if we look at the posterior abdominal wall, we have additional skeletal muscles that help to protect the kidneys. So these are the vertebra. And we have the iliac crest and the lower ribs with 11 and 12. The two major sets of skeletal muscles that are involved with support here. And we have the psoas major coming down and crossing the hip joint for flexion of the thighs. And then we have the quadratus lumborum, which is found between the lower ribs and the top of the iliac crest. So we would have psoas major and quadratus lumborum, and you can see those here. Here's psoas major, so that forms a medial, slightly posterior support, and posteriorly quadratus lumborum, and a little bit of the diaphragm high posterior. So if an individual's kidney needed to be transplanted, and the donor, say they're getting one kidney, it typically is not placed back in its original position because there's not a lot of physical structures that would hold this in place other than that perirenal fascia. And so the kidney is often, the new kidney, the donor kidney, is often placed down in the iliac fossa. Two activities that, because of their jarring effect, often, not often, but more often than other activities, result in a shifting of the kidney and a downslide towards the pelvis, or horseback riding, and truck driving, especially in our horrible roads here in California. A lot of that jarring, bouncing thing can cause the kidneys to start to slide down behind the peritoneum. So I've got a short video.
Professor, what does
Yes.
what does that cause when the kidneys slide down? Is there any
It could cause a kinking of the ureter and a blockage of urine flow. The ureter is the tube that carries the urine to the bladder.
You don't want a blockage.
No.
It hurts.
So this is showing a short video of access to the kidney, and you'll see there's a variety of ways of getting to the kidney. You need to give us a lesson on how to operate these buttons. Anyway, so they're going in laterally. So the person looks like they're on their back, but they're slightly rotated up. And so this is an incision that's basically right here, in the lateral aspect. More common now, I'll show you some images where more common incisions are made using laparotomy. Rather than a 6 to 10 inch incision, they use ½ inch to 3 inch, but several.
Have you ever aided in any kind of surgery, Professor?
Mm. No. So you can see the adipose tissue. When we get back to their,
Poking it, prodding it.
yeah, that's the skin.
Gentle.
Man.
So now they're scraping, cutting and removing the peritoneum.
Peritoneum.
So this is a lateral view, but they're in the peritoneal cavity right now. So there's the kidney.
No, that's the peritoneum or this?
That would be, yes, the parietal peritoneum. That would be the posterior abdominal wall.
How's
Ooh, that's like more blood. I don't see much
that?
blood.
Oh, there you go.
So the whitish color structure is the ureter. Seems much larger here than you'll actually see it out on the table.
I would
The
imagine.
veins are anterior, and the ureter is anterior, and arteries are posterior. So closer to the back. Now they don't want to go into the back because that's where we have our deep erector spinae muscles and thick muscles for postural development. We don't want to cut through those.
What is that moving? Is that his stomach?
Breathing.
The stomach would be, this is
That'd be the
a
diaphragm.
little higher, yeah,
That's moving everything, right?
right. They're tying off the veins.
This section.
So there's the ureter,
That thick, huh?
yeah.
Why is it so thick? Covered.
Carry a lot of your, whoa.
Is that why they
Well, they have to take, they're taking, this is the donor kidney.
Oh, right, okay.
And in the donor, I don't know if they just leave it tacked to the post-abdominal wall, because it would still be another 8 to 10 inches or so going down to the person's bladder that wouldn't be needed.
Testing of clamps?
What's testing mean?
Around the arteries,
So testing doesn't mean they're just checking to see if they work.
making sure they don't get wet.
Whoa, that's crazy. So if there's no arteries or veins hit, there's no bleeding then, right? So there's not a lot of blood in our body except for in vessels?
Oh yeah, all the blood should be in vessels.
Well, what I'm saying is when you have surgery, there's not blood rising around all them organs.
They cut them one at a time,
That
and either
clear
tie them
tube?
off or cauterize them.
Yeah, clear tube with the
Cauterize
red
them as
tip
they're going,
is-
okay.
Yeah, but they're tiny ones, they will cauterize them as they cut them, say in the skin. Major ones like this, they would
Tie them off.
tie them off on both sides and then cut between the
That's what
top.
I'm seeing, okay. Otherwise
Yeah.
you would be seeing, okay.
Now this looks bloody, it's in a basin, and they're adding saline, warm
Oh, yeah,
saline
see,
to
that
flush out the kidneys so clots don't form.
Ah,
And so that looks like a lot of blood around it, but it's just blood and saline together.
so they're rinsing out.
This is not the abdominal cavity, yeah, this
Is
is
this
just
in
the
the
basin.
UK or something with the spelling different?
Pardon?
The ischemia is spelled with the.
Yeah, it's British. So there's the ureter, you can see about 4 inches of ureter down the lower left.
So there's a lot of stuff they gotta cut then too, because you
Yeah,
got.
so then they're stitch back the peritoneum. I was gonna stop here, but the morning class wanted to see them stitch it up, so it's not very long.
So they can connect the two ureters there on the donor, I mean the, receiver.
I'll show you some pictures on where they where they connect those.
So they just seal off the superior and inferior veins?
There's something on the skin, right?
Pardon?
There's nothing.
Yeah, they usually glue like a thin film of, they spray it, but there's also, sometimes they'll put a thin
That's
film
also
of,
the healing?
Glue adhesives.
and infection prevents.
Oh.
I just healed my wife when she had a C-section and it was all the way across the stomach and. Wow,
Get looser.
it was just, yeah.
That was pretty old, huh?
The newer ones, I don't know what year it was, let's see if it was 2010, but they don't do, more common one now, are here's some views of